right. How do you screen for asymptomatic? What are the guidelines for this? There's some basic screening modalities that we use. The most common one being carotid duplex ultrasonography. Other ones that are also common include CTA and MRA, a little bit more advanced imaging, and costs a little bit more. But the carotid duplex is the workhorse of screening. So what are the indications to screen patients? There are certain patients that have the disease and elsewhere, which are higher risk of developing carotid stenosis. For example, patients with peripheral arterial disease. Interestingly enough, we don't look at this as much anymore, but one of the ways they used to pick up prior to good imaging symptomatic stenosis or asymptomatic stenosis was looking in the retina at the arteries for little cholesterol deposits that are being lodged from emboli from the neck in the retinal arteries. Those are called Harlan-Horst plaques. If you see those plaques, you have about a 13% chance of having some significant carotid stenosis. If you happen to have a Harlan-Horst plaque plus a bruit on auscultation, you have about a 37% chance of having a greater than 50% carotid stenosis. Patients that undergo coronary artery bypass graft surgery have had screening studies that show about 38% of them have significant over 50% carotid stenosis. And in patients that have atherosclerotic abdominal aortic aneurysm, similarly are reasonable to be screened. And there's even more advanced screening criteria, which I don't want to go into here, but they have a long list. If you have 2 or 3 of the various risk factors, hypertension, diabetes, et cetera, then you're reasonable to have a carotid screening study. All right. What happens if you have a symptomatic patient? So similar imaging modalities in that case. In the gold standards is angiography if you want to truly understand the degree of stenosis and what's going on with the plaque as far as ulcerations, thrombus layering, and all these types of things. CTA and particularly MRA have some advanced capabilities that are becoming closer and closer to being standard in many centers that may help us understand this without angiography, inflammation and the carotid cores and clot in the center of the plaque, et cetera. But right now, still angiography is for sure for degree of stenosis is the gold standard. And then of course, if you want to look for strokes in the brain as a result of something that sounds like stroke-like symptoms in this presence of a carotid stenosis, MRI is the gold standard there, and CT is also an option if the patient can't get an MRI.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.